Aloha guys, this is Dr. Tom Walker coming back at you. We're starting a new module, starting a new class, pharmacology. You'll notice in the textbook that rather than call him Chapter 7, it's Unit 7. How cool. I really like it. I'm being sarcastic. Okay, guys, practice of medicine is, to a very large degree, the dispensing of medications. And that's why it's so important to know. Drugs save lives every day around the world. They also take lives sometimes too. So, and I mean legally prescribed drugs, not street type drugs, of course. Okay, so we got to roll. We got a lot to go over here. Pharmacology is the study of drugs. It has evolved into the following subdivisions: pharmacodynamics, pharmacognosy, pharmacogenics, pharmaconomics, pharmacokinetics, pharmacotherapeutics, and toxicology. A drug can simply be defined as a medicinal substance that alters or modifies the function of a living organism. Generally, it has 5 medical uses: therapeutic, to help heal; diagnostic, to figure out what's going on; curative, also to help heal; replacement, like you need if you have a sluggish thyroid gland; or preventative or prophylactic, like giving you antibiotics before you're getting ready to have surgery, for example. Okay, drug names. Chemical is the formula that denotes the chemical composition of the drug. Now, many of these are quite complex. It's the actual organic chemical formula. Generic is the official established non-proprietary name. So, for example, Motrin is a brand name. That's the next one for an NSAID, a non-steroidal anti-inflammatory. But the generic name is ibuprofen. Ibuprofen. Motrin is one brand of ibuprofen. So this is something, guys, real important. You may know this already. Generic, or Tylenol, is acetaminophen is the generic name. Tylenol is the brand name. Okay. Drug sources. Well, initially, guys, they came from plants. Been the use of source of medication as far back as, we assume far back and before recorded history, using the leaves, roots, stems, fruit. Examples: digitalis, iodine; senestin, saw palmetto, which is used for prostate enlargement, BPH, benign prostatic hyperplasia. Minerals, natural occurring substances in highly purified form, for example, sulfur, magnesium, that kind of thing. Okay, some drugs come from animals. Very few drugs anymore. Made from fluids, tissues, organs, or glands of animals. Examples: Premarin, which is an estrogen supplement, if I'm not mistaken. There was more of this in the past, guys, and then once they discovered the drug, they were able to synthesize it and make it in a lab. You didn't need it from animals any further. And that's our next topic. Drug source is synthetic combination of various chemicals, may be identical to the natural drug or totally unique. Once they discovered and mapped out what the formula is, guys, they can often synthesize it. Can be produced in great volume, less expensive than natural drugs. We don't know what these are, so genetically engineered pharmaceuticals. Biotechnology used in healthcare, agriculture, and industry. There's a lot of drugs used in agriculture, guys. These animals like hogs and cattle and chickens and so forth sell by the pound. And so they'll pump them full of pharmaceuticals and antibiotics and things because they put on weight more quickly. Doesn't necessarily help the consumer of it, but hey man, since when do these businesses care about that, right? Utilizes gene splicing or DNA. Okay. They use bacteria, guys, to actually make the drug. They genetically program it to where it'll start cranking out the drug that they want. Biologics, vaccines, like COVID-19 vaccine. I hope you all realize the importance of getting that and don't listen to the idiotic propaganda out there. Blood products, recombinant therapeutic proteins. This is the recombinant DNA I was talking about. Okay. All right, now drugs are heavily controlled. I suppose they should be because they can be quite dangerous. All legal drugs are controlled by the Federal Food, Drug, and Cosmetic Act. Protects purity, strength, and composition of food, drugs, devices, and cosmetics. And the FDA, the Food and Drug Administration, is responsible for its enforcement. Guys, there's people that don't like big government putting their nose in things, but before we had the FDA, it was outrageous some of the stuff that was being put in things because there was no regulation. And again, I know there are businessmen and women who are right on top of everything and ethical all the way down the line, but there's a lot of them that'll do anything for a buck. Anything. Anything. Including cause people's deaths. Okay, so they made a Controlled Substances Act. Controls the manufacture, importation, compounding, means mixing them and putting them together, selling, dealing, and giving away drugs with potential of addiction or abuse. Examples: opium, cocaine, narcotics, stimulants, depressants. The Drug Enforcement Agency, always known as the DNA, is responsible for the enforcement of this. Practitioners must register with the DEA and have to renew their registration every 3 years. For example, medical doctors, they have a medical license, but they also have to have a DNA number, DEA, I'm sorry, not DNA, in order to prescribe medications. Drug schedules. Now, this is real important. You need to learn this. Schedules based on a substance's medical potential for abuse. As drug schedules change, so does abuse potential. The most dangerous are Schedule 1. The least dangerous are Schedule 5. So there's 5 schedules. Look at Table 7.2. You must know this. There's a lot of stuff asked about this. This is important. Let me say this. Some of it is absurd. For example, marijuana is still a Schedule 1 drug, which means that it's very dangerous and it has no medicinal purpose, and we know that both of those are BS. But for the most part, it's quite accurate. You must know these 5 schedules. So get them down. Here's Schedule 1, not legal for use in the U.S. High potential for abuse: heroin, LSD, hashish. Of course, hashish is concentrated marijuana. A lot of people, and myself included, do not agree with that. There's a lot of value to it. Schedule 2, high potential for abuse, but has medical uses in the United States. Demerol, morphine. Morphine is, is a supreme pain treatment, analgesic. Ritalin, used for attention deficit disorder. Schedule 2, low to moderate potential for physical dependency, high potential for psychological dependency. Marinol, barbiturates, paregoric. I don't know if they have that anymore. Schedule 4, low potential for abuse is compared to Schedule 3. So it goes from the most dangerous to the least. Accepted use in the United States, like Valium, it kind of calms you down. Schedule 5, lowest potential for abuse, accepted use in the United States, Robitussin AC. I think that's over the counter. Drug reference resources. Guys, there are many, many drugs out there. There's a lot to know. It is tremendous. United States Pharmacopoeia, National Formulary, New Drugs, list all drugs that's reached a certain frequency of use. Official list of standardized drugs. Though the one I'm most familiar with is this, the Physician's Desk Reference. Nowadays it's on computer. Years ago they actually had the book, and it's about that thick. Can you see that? It tells everything you want to know. You can look up any drug in there, any pharmaceutical. It also has plates with pictures of it, so you can identify if you have something you don't know what it is. You can whip through there. Of course, now, like I said, it's all on computer, but used to, you'd see this big old navy blue book about that thick. Product information insert. All these drugs and stuff have an insert, with all the warnings and things in them. Drug reference resources, drugs at FDA, official website. Searchable catalog of FDA approved drug products, prescription, and OTC means over the counter. In other words, like you can go in and buy, what's the one that Larry the Cable Guys is always advertising? Prilosec OTC. And you can go to the county fair and eat all that darn junk and take this, and it'll be all right. You won't be belching and burping. You'll still be eating a bunch of crap, but that darn Prilosec OTC is about $40 a month, too. All right, I know. Drug dosage determined by physician or qualified practitioner, like a PA, physician's assistant, or nurse practitioner. Important factors: age, the weight or body surface area. Big person got to have more drugs. The gender, medical history, the pathology, what's going on with them, genetic variants. And that's what these doctors determine, guys. Drug dose terminology: initial dose is the first dose. Average dose amount proven effective with minimal toxic effect. Most drugs have toxicity associated with them, guys. And so they really can cause problems with the liver. Loading dose. Larger initial dose to bring drug to therapeutic levels quicker. Say you have an infection, you go to the doctor, they give you a shot of antibiotics, and then they give you a prescription of pills. Maintenance dose will keep concentrations at therapeutic level. Minimal dose, smallest effective. Maximum, largest safe. I'm moving along here, guys, because we've got a lot. Therapeutic dose, amount needed or desired effect. Divided dose, fractional portion at short intervals. The doctor might have you cut the pills into two. Cumulative dose, summation of drugs in body after repeated medication. Lethal dose, the amount that could kill you. Toxic dose, the amount that can cause symptoms of toxicity. Okay, we're moving on to Unit 8. Introduction. Drugs are compounded in three basic types of preparation: liquids, solids, or semisolids. Liquid preparations contains a drug that's been dissolved or suspended. Fluids, fluid extract, lotions, liniments, sprays, aerosols, emulsions, solutions, suspensions, syrups, elixirs, tinctures. Make sure you know basically what these things are, guys. You'll have to look at you'll have some questions on that, but read the text to get all this down. Like an elixir has an alcohol base, no. Yeah, okay. Solid, semi-solid preparation, let's see. Offers great flexibility for dispensing different dosages of drugs. Tablets can be enteric coated. They have a special coating on them. A lot of this stuff, guys, irritates people's stomachs. So they have it enteric coated where it'll get past that without irritating the stomach. Buccal means cheek. Sublingual means put it under your tongue. Layered, just layered with different drugs. Scored means it's got a groove in it where it's easy to chop it in two. Some are chewable. Some are inserted in the vagina if you're a female. Effervescence like Alka-Seltzer. Plop, plop, fizz, fizz. Most of you probably don't remember. They actually used to have commercials up there where they did that. Capsules. It's like you pull them apart and they got a lot of little beads in them. Gel caps, caplets. Torches or lozenges, the kind you put in your mouth and let them dissolve. Suppositories. These are medicines you put up your butt. Also, you can have vaginal suppositories or urinary suppositories as well. Ointments and creams are rubbed on the surface of the body. You can also have transdermal patches like nicotine patches. 4 layers, impermeable backing, the drug reservoir, membrane to control drug release, and adhesive. Very high tech. It's pretty impressive. They're able to dispense the medication at the proper amount. Other drug delivery systems. Ocular, you can put them in the eye. Implantable, used for chemotherapy or insulin, where they implant it in you. Fast dissolving drug delivery system, FDDS, medication dissolves rapidly in saliva, used with pediatric, geriatric, bedridden, and developmentally disabled patients. Why, guys? Because a lot of these people can't take a pill for these reasons. They're a kid. They're old. They're bedridden. They're developmentally disabled. They have severe mental problems or retardation where they're not able to. Routes of administration. Subcutaneous means under the skin. Intramuscular means within the muscle. These are injections. Intradermal means right up under the skin. These 3 are injections. Intravenous means going in a vein. Intraarticular means injecting it like cortisone into a joint, like somebody with an athlete that's knee is all swollen. Classification of drugs, therapeutic actions. Let's see, preparation. The process of treating, relieving, or obtaining results through action of the drug in the body. See Table 8.1, selected drug classifications. Guys, always look at these tables. Now, they should be in the PowerPoint, but these PowerPoints, since they're all linked together, are pretty long, so they're often not. Please take time out to go back and look at these tables. Guys, this is your chosen profession, especially if you're an MA student. You need to know this stuff. Get about ready to run out of time. Fundamental actions. Drugs are grouped in 3 ways. Act directly on one or more body tissue. Act on invading microorganisms like chemotherapy, antibiotics. Place body chemicals and secretions like hormones. Agonist has affinity for cell receptor. Initiates a drug response. Antagonist blocks it. Okay, guys, we're running out of time. We'll continue our next one. Be there. Dr. Tom is signing off on this one.